sample collection. Assume all patients are potentially infectious. Practice effective hand hygiene procedures. Wear gloves during the procedure and the use of lab coats, masks, and other personal protective equipment wherever indicated. Wear closed-toed shoes or boots. Follow safe collection practices. Have knowledge of spill management. Get immunization, for example, the hepatitis B vaccination. Avoid contaminated equipment by doing routine and proper decontamination of surfaces and instruments. Practice proper disposal of sharps and infectious waste. Keep safety boxes at arm's length. The biomedical waste management. The sharps container must be within arm's reach and clearly visible to ensure safe disposal of sharps. The instructions for appropriate use and disposal can be displayed in the form of flow charts on the working station. Burn the needle and cut the hub of the syringe using the needle destroyer. Perform the following steps. Insert the needle in the needle slot. Push it gently downwards till arcing stops. Put the syringe in the syringe slot. Push the handle of the cutting blade to cut the syringe at the nozzle. The used syringes must be put in 1% sodium hypochlorite solution before disposal. All blood-stained cotton, bandages, etc. goes into yellow bags. All infected recyclable plastics like tubes, gloves, IV infusion line, catheter, etc. go into red bags. The segregation at source of biomedical waste is to be done as per local guidelines. Never disassemble an exposed used needle with your bare hands. Recapping of the needle is not recommended. If recapping of a needle is unavoidable, use the one-hand scoop technique to cover the sharp end of the needle and thus to safely remove the needle from the holder. One-hand scoop technique. Leave the needle cap on the surface and guide the tip of the used needle tip into it using only one hand. Place the needle cap against a firm upright surface with its opening towards the phlebotomist and place the used needle tip into it. Lift the needle vertically and once the tip is covered, use the other hand to fix the cap into place. Clean the surface with disinfectant afterwards to avoid leaving any drop of blood. Prevention and management of needle stick injury. The single most important measure to prevent needle stick injury is do not recap the needles. Destroy needle in a needle destroyer and use a puncture-proof container for used needles. Keep the container close to hand to avoid injury. It is equally important to use proper protective clothing such as gloves. In case of needle stick injury, follow the protocol laid down by the laboratory. which is written and displayed in the collection area and usually includes: allow the wound to bleed freely for a moment and then wash thoroughly with water. Apply disinfectant and first aid dressing. Note down the details of the patient along with the patient ID. Report the incident to authority immediately whose contact number is displayed. If injury is caused by a sharp having come in contact with a potentially infectious material, consult a physician as directed by your head of department, as post-exposure prophylaxis or immunization may be required. Management of spillage of blood or body fluids. A spill kit should be available in the collection area along with instructions for quick handling of spillage of potentially infectious material like blood and body fluids. The spill kit should contain disposable gown, gloves, face and eye protection, disposable absorbent material like disposable cloth or paper towels, disinfectant and forceps. Procedure. First, protect yourself using gown, face mask and gloves. Second, contain the spill by placing absorbent paper towel or cotton on the spilled material. Third, disinfect by pouring freshly prepared 1% sodium hypochlorite solution on the spilled material and leave for 20 to 30 minutes. Clean the area, taking universal precautions, using paper towels which should be disposed of in the yellow bag. Management of vasovagal or syncope attack. In case of fainting or vasovagal syncope, first stop the procedure, then lay the patient flat and lower his head and arms. Loosen tight clothing and call for personnel trained in first aid. Once the patient has stabilized, assure the patient, remove him to a comfortable area and observe. Make a note on the requisition form. In case of convulsions or seizures, call for help and stop the procedure. Have someone hold pressure to site and notify personnel trained in first aid. Lower the patient to floor and clear space to prevent injury and do not restrain patient's extremities. Documentation at sampling. It is important to document adverse incidents to find areas of weakness and improve and reduce pre-analytical errors. Record all double pricks. A logbook should be maintained by the technician indicating the number of needle pricks per patient to measure the pre-examination quality indicator. Daily filling of non-conformance form to record needle stick injury, spill and other adverse incidents. The procedure for management of adverse incidents must be displayed at the sample collection areas. Sample receipt, accessioning, processing and rejection criteria. The laboratory's procedure for sample reception should follow standard essential steps. All samples should be accompanied with test requisition forms with details like collection time, patient particular, fasting status, and short clinical history. Samples should be unequivocally traceable by request and labeling to an identified client by a unique lab ID number. All samples received should be recorded in relevant registers. Authorized laboratory technicians evaluate the received sample to ensure that they meet the acceptance criteria relevant for the requested examination. All portions of the primary sample should be traceable to the original primary sample with the help of laboratory numbering system. Specimen rejection. Rejection criteria are designed to prevent inaccurate data and to provide result accuracy. The following are the criteria for rejection: unlabeled samples, incorrect container or preservative, insufficient sample, suboptimal samples like hemolyzed samples, EDTA blood with clots, overfilled or underfilled tubes, improperly transported samples like cold chain not maintained, leaking urine or stool containers. Sample preparation. Sample preparation is required to enable optimum reporting and to avoid pre-analytical errors. All samples collected in serum tubes should be allowed to clot for a minimum of 30 minutes before being centrifuged at 3,500 rotation per minute for 10 minutes for biochemistry analysis. The centrifuging should be done within 2 hours of sample collection. All samples in fluoride tubes are to be centrifuged at 3000 rotation per minute for 5 minutes. The EDTA samples for complete blood count and ESR are processed directly. No centrifugation should be done. Urine samples are centrifuged at 1500 rpm for 10 minutes for microscopic examination after the physical and chemical examination are done. For therapeutic drug monitoring tests or toxicological analysis, collection is made in plain tubes. Do not invert the tube. Let the tube stand in the rack for 30 minutes till blood clots. Now centrifuge at 3500 rpm for 10 minutes. For coagulation studies, the samples to be collected in 3.2% sodium citrate tube. All other anticoagulants are unacceptable. The sample should be centrifuged at 4000 rpm for 15 minutes to obtain platelet poor plasma.